I've just done it.
Yeah.
You know what, she helped us do that.
Hello, Robert. It's Christine. It's Tuesday lunchtime, and I was wondering if you're coming in today. I've been trying to get hold of you. Did you get my messages? It's locked.
Yeah.
You know what, she helped us do that.
I'll call you later.
All I'm asking is that you cover for me.
No.
It's 10 minutes. No one will even notice.
Look around you, will you, Jay? What's so important you can't wait till the end of your shift?
You haven't got a number we can't call you, can we? Here's one. Hello.
Hey. Playing with the big boys then today, hmm? How's Robert taken it?
I haven't spoken to him yet. Drummond was supposed to let him know.
Yeah, he sent him a memo, apparently.
A memo? When does Robert read memos?
Well, now would be a very good time to start.
Well done, Christine.
Well, it's not exactly brain surgery, is it, gentlemen?
Robert,
Hey, where's Christine?
stabbing's on the way, serious and imminent. 2 of them, both males, possibly a minor involved.
Haven't people got anything better to do on a Tuesday?
Welcome back.
See. Very nice. Yeah. Where is she, by the way?
No idea.
And Danny?
Ah, to the rescue!
My hero. How's it going?
Oh, you know, thrashing villains, saving lives. How's he on?
Still can't play the violin, but apart from that, hey, find Christine for me, would you?
Has anyone told him yet?
Doesn't look like it.
Now, before we start, I'd like to introduce Christine Fletcher to our gathering. Christine has just taken up the new A&E director's post, which, as you know, has been created to handle the specific needs of the A&E unit. Dr. Fletcher, perhaps you'd like to say a few words.
I'm sorry, but there's an emergency in my department. Duty calls.
Mike, stab wounds to the chest. BP 8 over 40, saturation 90%.
How much blood we lost?
2, maybe 3 units. Victim number 2's in the other ambulance.
Danny?
I'm on it. What we got?
This is Stephen. He's confused wounds to the lower chest. Can you hear me, Stephen? BP's low. How low? 70 over 40.
Get you sorted out.
Keep him moving.
Cross-match 6 units. Quickly whack up the oxygen, 15 litres. Trachea central. Equal air entry both sides. Give us another line in, Jude, please.
Confused wounds to the lower chest. Looks deep. He's hyperventilating.
Don't you worry, Steve. Buck Bartley knows all the tricks. You just try and stay calm, son, eh? Nice deep breaths on that.
How are we doing here?
Blood pressure's dropping fast. Wounds deeper than I thought. Can you tell me what happened, Steve?
Just get him stabilised. No, I don't like this pressure here, please. Problem?
Sorry, I got held up. What are we dealing with?
Jude.
God for the pulse.
Shit is in EMD. Yeah, get him, Tube. Jude.
Yeah.
Adrenaline.
5.
Feeling mother? Good.
What have we got?
Stab wounds, EMD under control.
How much blood have you ordered?
Plenty. Wow. Where were you?
Meeting.
Danny! Need a chest drain over here. It's good practice for you. Left side. Where's your desk these days?
Did you get my messages? We should talk when you've got a minute.
Yeah, good idea. How are we doing?
Yeah, we've got open.
That's what I like to hear.
Good news?
Could be. Double decaf latte, 2 sugars. Right?
Yeah, thanks. Taking a break from the diet, are we?
Detective Inspector Blaine responding to a call about a stabbing incident. Any idea where we can find your clinical director?
Chris Fletcher? No idea, I'm afraid.
Reception, please.
Yeah, we're looking for...
Yeah, I know, I heard you, and you should know better. Out, now.
Oh, is this strict?
Not unless you like it that way.
Well, he's going to find out sooner or later. I'd rather he heard it from me, though. You should have told him just now, Chris. Recess is in the place.
How's he doing?
Blood pressure's levelled, signs are stable so far. What do you reckon, 13, 14?
As long as he makes 15, I'm not that bothered. What's the hold-up with theatre?
Backlog on rounds, apparently.
Yeah, that'd be about right. Keep up the obs until they find a window, will you? In the meantime, we'll keep them both here.
Could have been a mugging, I suppose.
Let's leave the detecting to the detectives, shall we? And here they are. Chris Fletcher. I knew it was a mistake to cultivate my feminist side. No.
Sorry, Robert, I told him to wait in reception.
It's all right, Sam. I'm Robert Kingsford. What do you want? Well, we understand there was a double stabbing admitted. Yeah, lateral chest wounds. They're not really chassis, but he would be.
What do you know?
Domestic incident, possible burglary. An identified female called the station. Some patient ID would be helpful.
I'll see what I can do.
Cheers.
Kids.
We need to sign in with your A&E director. New procedure. Any idea where he is? If I knew who he was, I might be able to help you. Well, we've got a Chris Fletcher in the job. Sorry? That's what it says here.
He looked well pissed off to me.
Trust me, Robert was pissed off. We'd all know about it. Big time.
What are that lot conspiring about?
Oh, playground stuff as per. So you're going to share your good news, or is it top secret?
Well, don't say anything yet. Christine's just given me the go-ahead to set up a new clinical trial.
How come you get all the cushy jobs? Anything interesting?
It's a new opiate. Should get some decent coverage out of it. For the unit, of course.
Oh, naturally.
You haven't seen Danny, have you?
Why? He's been a bad boy.
Robert's looking for him.
How do you feel about systematic error within a trial? Internal validity can be threatened by bias a lot of the time, can't it?
Well, I'm hoping that randomization, as in the creation of control groups that are comparable for any known or unknown potential confounding factors, should iron that out.
Hadn't thought of that, had you?
Christine, Mr. Drummond asked me to pass these on.
Thanks.
I'm a receptionist, not a postal service. Do you think you could let them know that?
I'll try.
Abdominal pain cubicle 2.
Miss Keys. Yes, I filled in the form. No, I do not want a cup of tea. I just need to see a doctor. Now, do you think you could sort that out for me, sweetheart?
I'm Dr. Fletcher, Miss Keys. You'd just like to lie on your back.
Alison will do.
Okay, Alison, let's have a look at you. Does this hurt?
Tell me you're fully qualified, please.
How long has it been like this?
A couple of twinges 2 or 3 months ago. Lately it's been getting worse.
I've been telling her to come in for ages.
Oh, shut up, Nick. I'm here now, aren't I?
Any history of gynecological problems?
No.
Al?
What? Oh, look, why don't you go home, sweetheart?
I'm sending you for a scan.
Which will take forever. It's pointless, both of us hanging about.
Coffee machine?
In reception.
Oh, Nick.
Have you seen your GP about this?
Well, it's irritable bowel. It's bloody obvious to me. Everybody's got it these days. In my line of work, anyway.
Well, I'd like to be sure, so I'm sending you up to radiology. 10 milligrams of morphine IV.
Oh.
Hey, Carl. How you doing?
forecast says rain later.
Come on, Joe, you can do better than that.
So, Christine's got a new job. How do you feel about that?
I encouraged her to go for it. I'm pleased for her. Just wish she'd told me first, that's all.
Well, I'm sorry, boss.
What's the sorry for?
Acting head and all that, everyone assumed the job was yours.
Politics and paperwork, no. Life's too short. Didn't want it. I'm serious. Until they create a job that's actually relevant to what we do, I'm staying put. Get that rumour started, will you?
Hello, stranger.
Well, what a surprise.
Long time no see.
Yeah.
What's this? Tickets? You shouldn't have.
For a patient.
Oh. I've brought a little something for you, actually.
Ah.
I thought perhaps you could wear it the next time we go out for dinner.
Well, thank you. It's very nice.
Aren't you going to open it?
Fiona, listen, I'm very sorry, but I don't think it's
What's the problem?
Not sure. They both got similar symptoms. There was no sign of it when they came in. Thinking maybe a transfusion reaction. The cross-matched blood hasn't arrived yet.
Heart rate?
Fast, very.
Yeah, you're right. They don't like the standard stuff, do they? What did they test?
B.
Both of them? Mm-hmm. Oh, trust these two to be special. Get Terry to check supplies. We might not have any.
You want to have a look at this and all? What do you reckon?
Some history might be handy.
Over there.
This one?
Yeah. Father and son?
Yeah, looks like it. Have a word with your police pals, see if they've come up with anything. Oh, and best involve Christine. Now she's the boss. Hey. Keep it down, will you? There's people trying to recover in here.
Joe, can you get those bloods in?
Did she tell you?
Sorry?
Alison, abdominal pain. I'm just wondering if she told you about the pregnancy cock-up.
No, she didn't.
I don't know much about this stuff, but it was a bit of a mess, apparently. Escopic?
Ectopic pregnancy.
Something like that. They had to take everything away. It meant she could never have kids.
The police are waiting for you in reception.
Right. When was this?
10, 15 years ago. It was before I met her, so I don't know any of the details. I can't understand why she didn't tell you.
Is she back from radiology yet?
No, she's still up there. Perhaps I shouldn't have said.
Let's wait for the scan, shall we?
Of course. Thank you, Doctor.
Hello? Sorry. Look, I'm going to have to call you back. Well, I don't care how urgent it is. I'm at work.
Nice to see some things don't change.
Sorry.
Tell? Yes. Training director revised parameters. What's that about, you?
Changing the job description. Thought you knew.
No.
Well, but I only just realised that you were in the dark on this. And I didn't think it was my place to tell you.
No, you're right. It's not.
Robert, glad I caught you. I haven't had a chance to talk to Christine yet, but I was hoping that maybe you and I could liaise at some level over these Plavitron trials. Formal, informal, whatever you like, really.
Who the hell are you?
Sorry.
James DaCosta, registrar. Christine's first appointment.
Appointment? Today's just full of little surprises, isn't it?
How are they doing?
Not good, they're reacting. You need some type B. Don't suppose they've tracked down the mother yet, have they?
No, but they're keen to. They think she's got something to do with it. Why isn't Robert dealing with this?
They said it was best to get you involved.
Did he?
Yeah.
That's right. Well, it's getting very tricky down here.
Why wasn't I told?
You wouldn't have been interested anyway, would you?
Wouldn't have been interested in being clinical director, no.
Robert, I have no idea why you weren't told.
That's bollocks. Live dangerously for once, Jack.
I'm not party to this sort of information, as you well know. I mean, sure, no one doubts that you could do it.
Well, that's a relief.
But given your talent for pissing the board off, I'm surprised you're surprised. I suspect if you'd known the conditions of the appointment, you wouldn't be too keen on it anyway, you know.
Really? What?
New registrar DaCosta, you met him?
The blonde bloke?
High profile, does a bit of TV, wears a lot of makeup. Ladies like him, apparently.
Oh, yeah.
As do the drug companies. Epimark in particular, who can be very generous when it comes to handing out new equipment. Drummond saw the opportunity. So no DaCosta, no directorship, so to speak. I'd say you were best out of it.
Let's come back, have some keys.
Thanks, Poppy.
Congratulations.
Robert,
Nice little job you've got there.
it's not the job I applied for.
I'm very well aware of that.
Did you expect me to turn it down?
No, I expected somebody to tell me it was on offer.
Drummond was supposed to have called you. I left messages on your answering
Chris,
machine.
we both know what's going on here. Let's just forget it and move on, shall we?
Forget what? Please, spare me the subtlety.
I don't do subtle, I wish I did. Being honest and direct has done me no favours, has it? Your winning smile, on the other hand, seems to have sealed the deal.
What's he up to?
I don't know. Has he asked you yet?
What's a cover? Yeah, but I'm not playing.
He's keen to be somewhere. I sense mischief.
You're not listening to me.
Look, can you get Sam to stitch this for me?
I will do.
I understand what you're trying to say, but the scan shows fibroids.
It can't be fibroids, can it?
Of course it can't. I'll spell it out for you, shall I, sweetheart? This scan is not mine. It is medically impossible for me to have fibroids. Oh, go and get me somebody who knows what they're talking about, will you?
Can I have a word?
I knew I should have gone private.
Let me guess. Menopausal denial. I'm not if I gynecology.
No, wait. Check with radiology. If they can't confirm that this scan is hers, then we're going to have to send her back for another one. I know it's unlikely, but if she says that her womb has been removed, then we have to believe her.
Or request her notes.
And risk her coming back for a return visit.
With you on that one. Leave it with me.
Right, let's get on. Where is it? Eh? Blood for the transfusions. Hello?
Hasn't arrived yet.
Well, did you confirm the order?
Yes.
Well, chase them up. I need these two in theatre.
It's on its way.
Good.
Keep it down, will you? There's people trying to recover in here.
Yeah, sorry about that.
Is he dead?
Touch and go for a bit. But he's a fighter like you, eh? Not long now. Come on, I know this is uncomfortable.
Is Mum okay?
Why? Is she hurt, Steve?
She went in a bad way when I left her.
Where is she?
He's conscious. The police are waiting.
Whoa, sorry. Don't worry about the police. Take deep breaths.
We have a word. Your timing's not good.
They're hassling me.
His heart rate is up, his BP is down. This is not the moment to bring the police
Thank
into
you
the
for
mix.
the report. I am aware of the situation.
Really? Then you will be aware that the blood hasn't arrived yet.
Why not? Where is it?
No, don't ask me. You're the one who's on top of the situation. Terry's chasing it. If you can't cope, Chris, ask for
If
help.
someone had seen fit to tell me, I could have done something about it.
Isn't it frustrating being out of the loop?
What is it with those two?
I would have thought it was obvious.
And me.
Oh, yeah. You want to share it with us?
Good-looking bloke, blonde bird with attitude, sexual tension, gotta be.
Well, that's not what I was thinking, but now you come to mention it. I'd have thought she was more James's type.
Oh, and you know what James's type is, do you?
I'm a doctor. I know what doctors go for.
Nurses, I've heard. You're in with a shout, love. Careful.
Oh, sorry. Well, whatever it is, I hope they sort it out. Got a week's leave due. If she stays in this mood, I've got no chance of getting it.
No chance. You might as well be pissing in the wind.
Chris! Please tell me that type B is turned up.
Went to Leeds about 10 minutes ago.
Well, how did that
I
happen?
have no idea.
Okay, I'll get onto the BTS. You tell Robert.
I'd rather you did.
No, thank you. I've done my time with Robert today. Blood transfusion service, please. Yes, I can hold. I am waiting. Hello, this is Christine Fletcher. I'm trying to get in touch. Yes, I'll hold. Hello? Hello?
Everything going smoothly then?
Why was Robert not considered for this position? The new job spec is far more suited to him.
Well,
Is it because I'm easy to manipulate, or are they just looking for a bit of skirt to redress the balance?
Bit of both?
So it's true.
Well, I don't know why everybody assumes it's me who has all the answers. Anyway, I just popped in to say goodbye because I'm off to London. I was wondering if you'd like a drink later?
I'm busy, Jay. What do you want?
I'm glad you asked that. A couple of mates and me were getting together later.
Your point?
I don't suppose you could let me get off a bit early tonight, could you?
I don't see the problem.
Champion.
Clear it with Terry. It's fine with me.
Oh, come on. He's been on my case.
Have a word. Is it urgent?
No.
Then find someone else.
I can't really. You're the only person who can authorise leave, and I was just wondering if...
What? Whether I was a soft touch? Because if I'm not, that long weekend in Barcelona is going to go for a burden.
Sorry, I asked.
Me too. What's the problem?
Where is it?
What?
What? 6 bottles of Chablis. What do you think? We're in a critical situation here. Some type B blood to be handy.
You bleeped me. I assumed it was here.
Yeah, well, it's not. What did the BTS say?
I couldn't get through to them yet.
Well, go and start throwing your weight around. You want to be a manager? Go and manage something. What?
Chris?
Excuse me, nurse. Could you tell me where...
Hey, all right. What's happened? This bloody job, that's what's happened. Why didn't I listen to my mother and become a teacher or a hairdresser or a nurse?
You're great at your job. We need you up there, don't we, Poppy?
Oh, come on. Everyone knows this is Robert's job, including Robert. Bloody Robert never stops reminding me of it.
You just have to get used to it.
You know, I don't want this job or any job by default.
That's not what happened.
Well, that's what it feels like.
Maybe if you stopped acting like a victim, people would stop treating you like one. It's an opinion.
Resources, please. Christine Fletcher, Clinical Director, St. Victor's A&E. No, I can't hold. This is an emergency.
Pressure's dropping, temperature's up.
There's a possibility in Bolton. Not much, though. We may have to prioritise.
ETA?
They're going to get back to me.
For God's sake, tell them I'll come and collect it myself if I have to.
Thank you. I'll bear that in mind. Heart rate still a problem?
Bit of a worry, yeah. I mean, blood loss wasn't as heavy, but with his age to consider, it's...
He should be priority, I agree. Another expander won't be much use.
We've been over this. The situation's under control.
Then you won't mind me double checking, will you?
Good fall, was it, Trudy?
Should be a law to keep dogs on a lead. Well, the owner didn't even stop to ask if that was... Oh, for God's sake, do you have to...
It's all right.
Are you... Oh, my... The girls in finance are going to love this.
Dislocation. Reduced pulse in the arm. We're going to have to move quickly. We're going to take you through to resus. I think a pull should sort it out.
The pull? What do you mean, pull?
It's not as scary as it sounds. We'll sedate you first and then ease the bone back into place.
Shall I get the orthopaedic on call?
A what?
This kind of thing is their speciality.
Well, if anyone's going to pull anything, I'd rather it was you.
I think I can manage this, Poppy. Straightforward enough.
Oh, shame, left my camera in the car.
Chase up the BTS, Terry. Try and get a definite time from them if you can.
BTS, please.
Card here from a Karen Wilson. Severe bruising and lacerations. You interested?
Why would I be?
Wilson, Mike and Stephen, looking for the mother?
You're a star.
I'll tell the police.
Well, no, you don't. She's here for treatment, not the 3rd degree.
Bring her through to minors.
Okay.
Oh, there's a surprise. Yes, I'll hold.
Ruth, could you?
Sure. What is it?
This is Trudy. Dislocated elbow. Fentanyl and midazolam should do the trick, and we need to get a quick X-ray.
Are orthopaedics on their way? Dr. DeCosta's going to pull it himself.
Shouldn't be a problem.
I can call Jack if you like.
I really don't think we need to bother him.
Oh, my mum's a big fan. It'll give us something to talk about.
Excuse me. Sorry. Opposable joints. It's very tricky. This is Jack's area.
I've got a reduced pulse to worry about. We don't have time.
Can I have a word?
Not just at the moment.
The fentanyl will take a few minutes to kick in. It's all right. I'll stay with her.
Okay.
Excuse me 1 minute, Trudy.
Mrs. Wilson. I'm Robert Kingsford. This is my colleague, Danny Barton.
Oh, hi, Stephen.
He's being well looked after. We're waiting on some blood for a transfusion, but the signs are pretty good. Mike's doing well, too, considering.
I think you're confusing me with someone who cares.
What happened, Mrs. Wilson?
Danny, what we got here, then? Oh, yeah, it's going to need a few stitches. Ask Judy to step in and give me a hand, will you, please, Danny? I think you should know that the police are here.
He's a good boy, Stephen. Always was.
You don't have to worry about anything, okay? I'm the gatekeeper here, and nobody talks to you unless I say so, okay?
He's a good boy.
Karen?
Hmm?
It's going to be fine.
Robert, Sunita on the phone. Something about Harry?
It's my son.
What are you still sitting there for, then?
Sorry.
You might be right about James.
Disappointed?
No. Thought you might be, though.
You know, she threw a wobble in the ladies.
Yeah, I heard. First day in the job and she's already cracking up.
Some role model we've got there.
Danny, I thought you said Robert knew, didn't you?
Yeah, I did. Hey, listen, you can talk to her later, all right?
I'm not squeamish.
Yeah, please, just wait there.
She came to us, so I'll sit in, if that's all right with you.
Okay, Trudy, let's get this bone back into place.
I'd like another minute just to make sure the fentanyl's really taken effect.
How does that feel?
Fine.
We're just going to sit you forward. That's it. Okay.
Oh! Right, perhaps we should wait.
It's all right, Trudy.
Oh! Dr. DeCosta, I really think we should wait.
For what?
An expert opinion, perhaps?
Jack, this is Trudy, dislocated elbow. Thought you might like to take a look.
Trudy, Jack Turner Orthopedics. Notes, Poppy?
Are you on the telly and all?
Pulse was a bit thready. Needed immediate attention.
So the immediate attention hasn't caused any nerve damage. Well, perhaps need a bit of counter traction here.
All right.
Popping. Right, a big deep breath, Trudy. It's
What?
won't last long. Just, there we go. There we go.
Is that it?
Yeah, well, it's easy when you know how.
Really? That's it?
Well, not the most entertaining procedures, but not all of us doctors have an audience to worry about, do we? Thank you, James.
There you go. Excuse me.
I could have dealt with this.
By doing a second scan, we've eliminated the margin of error. You do have fibroids. We'd like to send you up to gynecology.
Gosh, you people just don't give up, do you? Well, it's the only way to get them off my back. I'll meet you outside.
I'm not going anywhere.
Oh, for God's sake, Nick, just go. How many more times?
We have a patient confidentiality rule here. If she wants you to leave, you have to honour that.
So, gynecology. Do I go straight up?
No, we refer you. You've put us to a lot of trouble. You've cost us time and money. I'd like an explanation.
Do you have children?
2.
I thought so. Were they planned?
I don't see what this is.
What I mean is, you wanted them, yes?
I've been lucky. Yeah.
Can you imagine not wanting them?
No.
Then you wouldn't understand. Sometimes it's easier to say you can't have children than you just don't want them. Better to be barren than soulless. Nick wouldn't have understood either.
Danny. Told you to wait.
She went to the police herself. Told them it was her. She did it.
What, she stabbed her own son?
Domestic turned nasty. Steve got caught in the middle.
Blood's on its way. They're sending an emergency vehicle straight here.
How long are we talking?
An hour, 45 if we're lucky. Tell Terry we'll be ready in 40.
What's this? Not a happy face, surely.
Relieved, more like. James is setting up some clinical trials and he's going to need a nurse to give him a hand. Who would you suggest?
Not me, not with my workload.
Of course not.
What does it involve?
Paperwork, mainly. And being there for James when he needs help with the patients.
I'll do it.
I wasn't aware you were asked.
Fine.
Sam, find him, talk to him. If he says yes, then it's yours. She's ambitious. We should encourage that. And anyway, if it gets her out of my hair, it's got to be worth it.
Hi. How are you?
Oh, okay. Nice tie. Was it new?
Yeah. It's a bit pink, don't you think?
Oh, it's dashing.
Dashing?
You off?
Yep.
Let's see a drink.
Yes.
Oh, come on, where is it? Who did this to you, mate?
Danny, leave him alone. Don't upset him.
Did you find the woman?
Yeah, the police are talking to her now.
It's all right. Yeah? She told us what happened. It's not your fault, Steve. You just...
How are they doing?
Cutting it very fine.
In the way. That's all.
They've just arrested the mother.
Let's keep this up.
Don't let him take her. I had to do it.
Robert? What?
He did it.
Bad this time. had her on the floor. He said he was going to kill her. I got scared. I had to stop him. Don't let him take her. Don't let...
Steve, can you hear me?
Steve!
The MD, where's Ruth? Got it with the bacon. Danny,
on it.
I'll do it.
There you go.
The MD.
Intubating now. Can I have the bag? And it's done.
Nice one. I'll put back.
Nice, Chris.
But I thought you were supposed to cut up your old ones, not buy you a new one.
Well, not Fiona's style, fortunately. No, we came to an understanding. We both wanted different things.
Would Christine be on this list of different things? I see. Why do you miss the company?
Well, there are a lot of things I'll miss about Fiona, but do you know a company isn't one of them? I'm a straightforward bloke. I like life to be straightforward. So.
Uh-huh. Well, if it is straightforward you want, I'm sure we can fix you up. There's plenty out there.
Come, point one in my direction, could you, Ruth?
A bit long in the tooth for that, aren't you, Dad? Hello. I'm glad I caught you.
Hi. Jack, this is Tessa. Tessa, this is Jack Turner.
Ah, I've heard all about you.
How long do you think we've got?
Well, if it's not here in 10, we might as well pack up. Because they're going to.
Do you fancy another? Raj?
No, listen, I should be going, actually, you know.
Oh, come on, Jack. Drown your sorrows. Jack offloaded a girlfriend today.
Really? Free agent then? Though not for long. Surgeons are so devilishly attractive.
Oh, yeah?
Yeah, definitely. I wouldn't have looked twice at Ruth if she'd been a greengrocer, I guess. What? Oh no, I'm sorry. Sorry.
Tessa's my partner.
Oh. Right. Terrific. I mean...
Careful there, straight boy.
No need for it to become common knowledge, is there, Jack?
Oh, no, of course, no.
Thanks, Raj.
No, I understand Sunita's become the resident A&E babysitter, is that right?
Little Harry. Oh, she's happy to help. Anything for Robert.
Dad.
How is he?
He's fine. He should be here later. Hoping we can persuade him to stay for something to eat. Works too hard.
I meant Harry, actually.
Oh. I should check on him.
She's the one who works too hard. Started some course with the Open University. Still, maybe with a good education behind her. Maybe one day she'll earn as much as you, Jack.
Sure.
You see, everyone around here thinks you are a stud. You must stay. Where's Lou?
Over there. Cheers.
Yeah.
Christine seems to be settling into her new job.
Yeah, doesn't she? Yeah.
It's a relief. Wouldn't want her to think she's being played for a puppet. Be a bit of a worry, particularly for you.
I don't see why.
If they're prepared to appoint DeCosta on an excuse, what's to say he's not lined up for further promotion?
Registrar's here today, gone tomorrow, you know.
Drummond's golden boy? I don't think so. And if Christine doesn't perform, well, he's perfectly placed to take over, which, call me psychic, I get the feeling you wouldn't be too thrilled about.
Outrageous suggestion.
Well, you know Drummond better than I do. And if Christine's comfortable, well, you've got nothing to worry about.
Listen, I'm going to leave you two on your own. Have a nice time.
Thanks. 5 minutes.
Danny, make sure Steve's ready. We'll do Mike with the surplus.
Sorry? Hang on, Danny. Since when did we agree that Steve was our priority? As far as I can remember, Mike was first on the list.
I don't think we've got time for a debate, Chris. Why don't we just do it?
And you've decided that?
Yeah.
On what grounds?
Come on, not now.
Mike is older. He's weaker. He should be our priority.
Stephen's lost more blood. Oh, for God's sake, the kid's suffered enough.
Now you're dealing out justice as well as medicine. He may be an abusive father, but he's got as much right to treatment as the next person.
Why don't we discuss this when the blood arrives?
There is nothing to discuss.
Where's Christine, boss? No idea. Don't think we need to involve her, do we? Get back to pathology. Thanks a lot. Thank you very much.
Got a minute?
Not really, no.
Right, I'll come back.
What is it?
I, for one, think you're a formidable woman, more than capable of pulling off this position.
Yes?
Emergency vehicles arrive. Blood delivery?
Right.
It's very important for me that you know that, okay? You should go. I'll see you in a few days, yeah?
Yeah. Robert, a word.
No time.
Now, please.
Don't do this, Chris. It doesn't suit you.
As clinical director and resource manager, I have to insist that Mike is priority.
I see. Playing it like that, are we? All right. As Stephen's doctor, and I am talking patient ownership here, by the way, I would highly recommend that he be the first to receive the blood transfusion.
Don't patronise me, Robert.
Stephen is my patient. This has nothing to do with your managerial position.
Nothing to do with it, my arse. Mike's need is greater, and you know that. The only reason you're digging your heels in is to prove to yourself that you still have a voice.
Bollocks.
And I'll be damned if I let you do that at my expense.
Sorry, whose expense?
Mike's. You heard me. He's older, he's weaker, he should be priority. Terry?
Michael first, then?
Thank you.
Well, I'm phoning you now, aren't I? You're my brother, not my dad, Michael. What is it? This is my job. What do you expect me to do? Oh, just get off the phone.
Bad news. Christine tells me you're going to be my glamorous new assistant.
Yeah, I'd like to be, if that's all right.
There's nobody I'd rather work with. These trials are going to be really important, actually. It's got to be one of the most powerful new opiates on the market.
Yeah?
Do you fancy going for a coffee? Talk it over.
No, I can't. My next break's not for a while yet.
I can wait. Not for long, though.
Sleeping on the job. You need toughening up.
I'm not apologising.
Not asking you to. Father and son are doing well. Nice place you got here. Nice workload too, by the look of it.
Are you going to bring this job up at every opportunity?
Nope, you're perfect for this job. You must be. I taught you everything you know. You do know that you're not my boss, don't you?
I wouldn't dare to presume that I was your boss.
And I'd watch the tantrums if I were you. They could get you into trouble.
That'd be right. You have principled outbursts. I, on the other hand, have tantrums.
All these doubts you have, they are purely your own. Everybody, including me, has absolute confidence in you. So I'll leave you to your paperwork.
Robert.
Oh. Ah, a memo! Fantastic.
Read it.
Must I?
No, I'll paraphrase. Epimog are giving us a lovely new ECG machine in appreciation of our projected work with their new wonder drug, Plavitron.
How'd you pull that one off?
What's the winning smile good for if you can't pull a few strings?
No, Jay. Come on. No. Danny.
Hi. What's he like, this fellow?
Thank you. Okay. Good luck. Don't come back too soon, though. Bye.
That's my line.
Pleasure. Bye. Enjoy skiing.
Do you do it deliberately?
What?
Look at them. You could turn milk sour with those faces.
Sometimes it pays to cause a few ripples.
Ah, Geoffrey, I was just coming to find you.
You've got the files, I see.
Yes, you seem to have sent me some I don't need, though. Let's see. These don't seem to be part of my job description. You must have confused me with someone else. Organising the Christmas party raised a chuckle. Good thing I've got a sense of humour. Anyone else would have thought you were taking the mickey. There. That's it. Now I can get on with being a doctor.
You can slink off now, Jay. I'll cover for you.
Oh, cheers, Terry.
Yeah.
Boo.
Boo.
Do you fancy that chap?
Don't like your office much.
It's just a temporary measure.
You're a bad boy, Dr. DeCosta.
Better believe it.
This is a sackable offence.
I've let Jay go, so don't go looking for him.
Remember me? Should they? My brother was the only family I had. I told you to watch your back.
We're all very sorry about what happened.
Unlike you, I'm a man of my word.
What was that?
Who cares?
What are you gonna get, whoever did that to you? I would. What you've got?